I've read your lecture notes, and I think I've read there rather in the beginning that public health is not without values. This element of values is something I haven't found here in your replies to the question, whereas you put it as on the first page on what public health is about. So what do you mean by these values? What are they, and why is it important or not?
Well, values guide the choices policymakers make, politicians make, people who are in charge of health systems make. So there are always values at play, but they're not necessarily always explicit. What we want to emphasize in our teaching, and we are very clear about it, these are the values that guide us in the choices we make, in the decisions we take. Let me give an example of what I see as three key values. The first one is about solidarity. Solidarity is about trying to develop systems and funding in a way that is inclusive. Everybody, we should leave no one behind. Even the ones who are poor, who are old, who are vulnerable, who are frail, who are ill, they need to be on board, which implies, this is by essence political choice, that the ones who are better off contribute to the others. So solidarity is about redistribution of resources with the acknowledgement, the recognition, the approval by the community, because it's a political decision. It's not cut in stone. One can downplay, one can reverse solidarity if different choices are being made. So solidarity is really key. And the way how this is implemented, the extent to which solidarity is exerted, is put into practice, depends from one country to the other, depending on political choices. A second value, I think, that is quite key, on which we insist, is participation. The health system is there for the people and not the other way around. So people should have a voice in the process. They should be listened to because they are in the position to best appreciate what their problem is, how they perceive it, and so they should have a say in the process of their individual care, but also in how care is organized at a more population level. Not to impose things, but to interact with professionals and find somehow a balance between, let's say, a professional logic, yes, a medical logic. After all, health professionals are also technical people. They have a skill and they should talk about these things, but it should be balanced with how people see. So this interaction should be optimized. And the third value is, and it's linked a bit to participation, is about autonomy. People are in the best position to decide what a healthy life means for them. It's up to them to give a content and not something to be imposed by a system. And this implies that, let's say, the level of health or the extent of health may differ from the way how this is appreciated, may vary from one individual to the other, from one community to the other, from one country to the other. But it should be, eventually, it's people's decision, and this is a little bit linked to, I think, Tine, you mentioned the concept of well-being, to this idea of well-being. Health is only for people a relative priority. We medical doctors tend to forget this a bit. We see this as an absolute sort of thing. For people, it's not absolute. Good health status is, of course, important, but it needs to be balanced with, do I have a family life? Do I have significant social relationships? Do I have a job in which I can develop myself? Have I a proper housing? Do my children have proper education? And people juggle with all these things, balance them, and eventually health is a relative priority. And this is up to people to decide. So autonomy is also about respecting these things.
I completely agree. And while you were talking about health in general, which may be of not absolute importance, of relative importance to people, I was thinking on specific disease control programs, things that came up frequently in the students or the participants' replies. And so imagine that I'm involved in the control of cysticercosis, and I'm mainly concerned with reducing the incidence and prevalence of that, of one specific disease, then those values of people's autonomy and participation are even less obvious.
Yes, yes, I agree. Now we should be aware that the kind of programs you're describing are targeting a population of which many people are actually healthy. It's about preventing these problems to occur or reducing the transmission of these problems. So, other things remaining equal, this is a lesser demand for people than individual curative care, where they are suffering and the demand is very strong. So necessarily, because the demand is less obvious, you need somehow a little bit of more directive approach. Now, there's in se nothing wrong with this if this is somehow discussed with people and accepted by people. I think that one of the big challenges in health systems is precisely to balance this population approach, which tends to be indeed more top-down oriented, perhaps a little bit more directive. On the one hand, it needs to be balanced with more bottom-up approaches, starting from people's demands and needs as they perceive them and as they express them in individualized patient care. Because if these two are organized together, one can build on the capital of trust, of confidence, generated by respectful individual care to enhance acceptability for more top-down programs.
Yeah, I think the word trust is key, and one of you also wrote on the part on communication challenges that mistrust is one of the problems to overcome. Now here we talk about trust between a health professional, a health provider and a patient, but there is also trust between different types of actors, stakeholders, when we talk about a One Health approach. And so to trust each other, we have to try to first be open to the logic of others and not close ourselves. A lot of you talked about silos, so we have to come out of our silos to be respectful and to be open and to be willing to listen to each other and to learn from each other. And I hope this will be, one of the tasks, of the learning tasks of this module is trying to understand the logic of public health. We have unfortunately no public health professionals within your group, but we will try to make you discover